That South Africa-Cuba Health cooperation agreements gives impetus to South Africa's planned national health insurance. He was speaking at the graduation ceremony of 70 doctors that were trained in Cuba.
The program has been one of the ways to address South Africa's critical shortage of doctors. The need is especially desperate in rural areas. Since 1997, Cuba has trained more than 500 South African doctors. Cuba's health system, which focuses on preventative healthcare, fits in with South Africa's own goals to make good quality healthcare accessible to all citizens.
Our hope is that through our Cuban trained doctors, that they will play a significant role in assisting us to ensure that South Africa's health outcomes get closer and closer to that of the Republic of Cuba.
The graduates, mostly from disadvantaged backgrounds, spent 6 years studying and training in Cuba. Phaahla from Mpumalanga was raised with 4 other siblings by a single mother.
Those 2 years that an integration between the Cuban healthcare and the South African healthcare, and during my stay there in UCT, I have recognized that I'd like to specialize one day in pediatrics.
Mdumiseni Mkize from the KwaZulu-Natal South Coast says his parents were unemployed. He's keen to specialize in surgery.
Cuba does that. It gives that qualification because it installs that humanity in you, that you should always put your patients first, your community first.
More than 3,000 South African medical students in various years of study are being trained at universities in Cuba. In 3 years, more than 700 are expected to qualify. Renee Heiner, SABC News, Durban.
In a week